Hello there and welcome to My Zone Online School. My name is Mr. Ashela and I'm here today in the studio with my friend. This week's theme is health education, but before we begin, I would like us to sanitize our hands. As we all know, we have to abide to the COVID-19 rules. We have to do it thoroughly through your hands, around your thumb, even on top of your hands. Okay, and when done that, make sure your hands are dry and do the distance drill to make sure that you're not touching anyone. And today's lesson is community health. Grade 5s, let's turn to page 14 for this week's lesson. This week's theme is health education, and our topic is community health. We'll start with our basic competencies. I'll go through one by one. I'll start with the first one: identify and report on local health factors and services affecting the health of individuals, families, and the community. Describe and relate how lack of provision of local community health services affect the health of people at home or at school. Right. To understand our basic competencies, we'll begin by pinpointing or picking out the difficult terms that we might have problems with. We'll begin with the term community. Right. It says here, a group of people living in the same place or having a particular characteristic in common. Right, what does this mean? This means your community is basically your area where you live, be it at home or at school at that point, if when you're at school, or any other location where you interact with the people or the animals that are around you. Right, health. The state of being free from an illness or injury. Right, this one is quite straightforward. I don't think we need an explanation on that one. Health care, the organized provision of medical care to individuals or a community. This is provided mostly by our government, the nurses, the doctors, and so on. Right. Medical, relating to the science or practice of medicine. Right. This simply means that it relates to things that have to do with medicine, science, as in the doctors, the nurses, and everybody that basically gives service that have to do with your health. Right. Let's begin now our lesson. Let's tackle the basic competency 1. Right. Local health factors affecting the health of individuals, families, and our community. Right. I've made a spider monkey here for us with our health factors or things that affect our health in our communities. We will start by, we will begin by pinpointing out these factors, which were already pinned out here by my friend, which is community safety, environment, the money, housing, and a job. How do these things affect our health? Right. Let's start with the job. For instance, if your mommy at home doesn't have a job and you get sick, how do you go to the hospital? Because at the hospital, we pay a certain amount, and if the mom doesn't have a job, it means there's the money to pay for the services that are offered at the clinic, for instance. Right. Housing. How does this housing affect us? How is it a factor? If you don't have a house, for instance, if you don't have a house, and okay, not say you, but maybe street kids, we know we have street kids that are living under the bridge. Those kids will not be safe because then they are being exposed to the cold, the heat, and being bitten by mosquitoes. There's just no safety at all. Right. Now that we have looked at the factors affecting the community, let us look at how the lack of provision of local community health services affect the health of people at home. Right. The first one is the common one. It says here, lead poisoning. This is the water that we get from our taps at home. When you see it looks a little bit brown, it means it has lead content in it, which means that water is unsafe to drink. So the best way to keep it clean is to boil the water, have it, or you can buy water at the service that looks clear. It shouldn't look a little bit brown, because this causes or affects the brain or the nervous system, which will result in poor concentration in class, or maybe a child being born with a certain disability. All these things are caused by lead poisoning. And that's what is standing there in our book. On page 15, we have substandard housing such as water leaks, poor ventilation, dirty carpets, and pest infestation can lead to increase in molds, mites, and other allergens associated with poor health. This simply means that it's the little things, even just cleaning the dishes at home to prevent cockroaches. Cold indoors conditions have been associated with poor health, including an increased risk of heart disease. With extreme low and high temperatures have been associated with increased mortality, especially among vulnerable populations, such as the elderly. And residential crowding has been linked with both physical illness, such as tuberculosis and respiratory infections, and with psychological distress among both adults and children. And now with the current pandemic going on, COVID-19, it means that these households will find it very hard to keep up with the prevention measures of social distancing if they don't have houses, for instance. Because most of our houses in the outskirts of Windhoek have no structure of streets and stuff, so they just piled together, and the people don't really have enough space to distance themselves. So because some of them live 6 in a kabashu, and so on. Now that we have looked at our health factors affecting our communities, we also looked at how the lack of provision of local community health services affecting people at home and at school. We will have time for our quiz. Let's have a look at our fun quiz time. Our first question for this quiz is, name any type of health factors or services affecting your community. The second question is, how does lack of provision of local community health services affect the health of people at home or at your school? Right. You can just note down at the notes there where it says notes on your booklet. You can give answers there and get help from your auntie, your uncle, your mom, your dad, your brother, sister at home can help you answer the questions. Right, I hope you enjoyed today's lesson, and also remember to always sanitize your hands. Remember your social distancing. Always wear a mask in public. And from us in the studio, until next time, ciao.
Joshi, and make sure to always make a helicopter circle, stretching your arms out and spinning around like me. And make sure you're not touching anyone while doing this. Goodbye.